Now, as we reflect on Youth Day, UNICEF says about 73% of youth needed mental health support over the past year, protecting adolescents from adversity and promoting psychological well-being remains a challenge. Dr. Terri Henderson, specialist in child and adolescent psychiatric, joins us now to unpack some of the other challenges that make adolescents vulnerable to mental health problems. A very good evening to you, Dr. Henderson. Thank you for your time. Looking at the latest UNICEF South African U Report poll, it really speaks to the importance of a need to further scale up when it comes to mental health resources for young people. And the findings have been interesting because with 67% of respondents supporting a friend with their mental health issue over the last 12 months. What stood out for you within this report?
Okay, so I think the 76% of mental health difficulties is accurate, extremely correct. I like the idea that they're sort of acknowledging that we do need to raise the level of input and acknowledgement of mental health illness in adolescents. There's very little in that about resources, but I'll come to that now. But I just want to comment on something about teenagers finding relief in talking to other teenagers. I think that's useful up to a point, but we do have concerns about that because teenagers don't have the skills to manage significant issues in their friends. And teenagers talking to teenagers gives them the impression that they are talking through their problems and might come to a solution, but in fact it doesn't. It gives a double negative. Both are now talking about negative patterns of thinking and negative outcomes, and in fact it doesn't always help. So hats off to those who did call on a parent or a teacher and get an adult to be involved for supporting their friend. So I just want to make that point because that particular comments a lot on how teenagers use their friends, and that seems to be a sort of positive intervention, but caution on that.
Yeah, absolutely.
So in terms of, if we're talking about, I just want to make clear so some things is that as a society we're still starting to have to accept that mental disorders don't start in adulthood. They start in adolescence and sometimes start in childhood. So that's something that we need to get clear. So we're giving energy in towards adult mental health care, but a lot of it needs to come earlier. Because if you treat the child and you treat the adolescent, you're going to get a much better outcome as an adult.
Yeah.
So you're getting healthy, functioning adults. I spend a lot of time convincing people, the supposedly well-known people, that mental disorders do exist. So something as common as depression definitely exists. And also that what people like to talk about is the sort of moodiness, hormonal moodiness of adolescence, and surely it's all sort of within that normal hormonal moodiness, and definitely not. In some cases, but that's when adolescents are still functional, but in most cases that's not an adequate explanation. Very important to get across is that adolescent mental health issues are treatable and can be successfully treated. But it brings me to the resource issue which we face as a significant crisis with this country. And I'm going to give you quite a clear example. So, for example, if you're a GP or you're a doctor in a clinic or you're a nurse and you're sitting with an adolescent who has quite significant depression, they have some suicidal thinking but can be convinced not to go through with it. But it's very clear that this adolescent needs admission for psychiatric care, for treatment, and to be kept safe. Now, there is not a single place in the entire country that can admit an adolescent like this for psychiatric care. Not a single hospital. There are no beds for these adolescents. The only adolescents that are getting inpatient care in our country system are adolescents who are so severely ill that they are either harmed themselves or others. And then they will go into a locked ward, and not for adolescents, but a locked ward with adult patients who are psychiatrically very ill, which of course exposes them to enormous trauma and significant further risk for their mental health and their physical health. So that is an unbelievably distressing situation. I mean, for example, let's compare it. You have a 13-year-old who has a cough, develops a fever, is very sick, You go to your GP or to your clinic and they say, right, pneumonia, we're going to admit your child into the ward and they're going to get treated. But your child has depression and is suicidal, and they're going to say, well, I'm sorry, there's absolutely no way I can send your child. And I cannot tell you how devastating that is, because if we can treat adolescents, we can get them to good recovery. They can get through a healthy adolescence and they can be healthy and successful adults.
You say, pardon the interruption, you say it starts, Dr. Henderson, perhaps sometimes in childhood, progresses into adolescent stages. What should the warning signs be? What should parents be looking out for? Very quickly, because we're about to wrap up soon.
All right. Well, it's first to say that children in South Africa are growing up with enormous amounts of adversity in terms of absent parents, substance abusing parents, and unsafe environments. So symptoms that present typically, I'll talk about adolescents, is adolescents who are no longer functioning like they normally do. So withdrawing from school interaction, withdrawing from family interactions, from friend interactions, marks are declining. They're not going to school. They're avoiding things and withdrawing, and it's particularly spending a lot of time on their own in their room, for example. So a strong sense of isolating and withdrawing from the world that they know and the lives they were leading. That is a warning sign that your adolescent is starting to battle with their mental health. And what adolescents tend to do is to withdraw and pull away. They don't put up their hands and say, look, I need help. If they do, please don't ever ignore that. But they tend to withdraw and get harder and harder to access. And it's not that easy to then get the information from that. They will more easily talk to their friends. So often adults and parents are the last to find out. But those are the key features of someone who's not doing well, an adolescent who's not doing well.
And very quickly, some solutions. I mean, you mentioned the one factor which really stands out, that they can't be separated from the adult psychiatric patients. But, what are some of the other immediate solutions?
So the solutions are, I think if we can, firstly, we need more knowledge out there in terms of how to treat these things, and that goes at every single level. That's from clinic level to doctors to nurses, etc. Many are not familiar with the treatment regimes and are uncomfortable in treating adolescents. So we need people to know and to know how to treat. You can, obviously, if you catch these things early, we can manage things as an outpatient. We can use both medication. If we're lucky, we can find a psychologist who can perhaps provide support, or a counselor. And if we're lucky, we can find a social worker who can perhaps support the family. If we intervene early, we don't need inpatient care. But then we need to be picking things up early. So we want people to know about the warning signs. And that includes parents, teachers, coaches, schools. Schools are really important in terms of what they can pick up and how they can help us with that.
Yeah.
So, there's more information to everybody that would really help us and really help teams.
Thank you so much. Thanks. We're going to have to leave it there for now.